Hello there. Take a seat. I'm Dr. Sarah. Nice to meet you. So what brings you here today? Oh, okay. So you've got some discomfort around your ears and you think you have a lump near one of them? Oh, okay. All right then. How long have you had this? Okay, so your ears have felt a bit odd for a few days, but you've only just noticed the lump. Okay. Have you had problems with your ears before? No? All right then. Well, what I'm going to do, I'm going to give your ears an examination. I'll look at the external ear and also inside your ear too. Are your ears itching at all? No. Do you feel a little bit sore? But more so around the ear with the lump. Okay, that's fine. Now, do you put cotton wool buds down your ears at all? Okay, alright. Well, no, you shouldn't really put them down, only around the outer ear. Okay. But a lot of people do. I know, it's very tempting if your ears are a little bit itchy, you want to try and dry them off. But try not to do that. Okay. You've not noticed any discharge from your ears at all? No. Okay. Well, what I'll do first, I'll give your ears a little wipe around, okay, on the outside, and have a check around all the outer parts of your ear first. Okay. So, just got some spray, which I'm going to spray onto this lovely soft gauze, alright? And this won't sting or burn at all. Alright, so you keep your head nice and still for me, and I'll just pop and take a look at this right ear first. Okay, so let's just give this ear a wipe. It's nice and refreshing because I'm just going to wipe the top of the ear. There we go, and just come round down to the lobe, just around there. Okay. Does that feel okay for you? Okay. And just a little bit more around there. Okay. Just going inside the ear a little bit, just to wipe around there. Okay, that looks okay. I'm just going to do your left ear now. It's nice and cool and it smells lovely. Skin feels fine, doesn't it, after I've done that side? Good. Okay, just going to this side now. Alright, just wiping the top. Okay, and around. And coming down to the lobe. Okay. How does that feel? Good, this all looks fine. And just inside there, just a little bit inside the ear. There we go. There we go. Okay. So now that they're cleansed, I'm just going to have a little press around the ear, okay? And I want you to tell me if anything feels uncomfortable. Alright? Okay. So, let's just press the top of the ear. Is that okay? Good. Just down a little bit further. Alright. And down to the lobe. Okay. Does anything hurt there? No? Okay. Does that hurt? No? I'm just going to pull up on the ear a little bit. Okay. Nothing really hurts there. That's good. Can't see anything untoward. Can't see anything unusual there. Alright, let's have a look at this side. Now this is the side I presume has got the lump, because there wasn't a lump that side. Okay. I'll be very gentle, but do tell me if anything is uncomfortable, okay? Okay, so just gently pressing around the top of the ear and coming further down. Okay, that feel a little bit sore. Alright, down to the lobe. Okay, I found the lump there that's just by your earlobe. Just going to palpate around that area. Does that hurt? Only very slightly. Okay. Alright, yes, I can see that and I can feel it too. Just going to pull up slightly on the ear. And that feels a little bit sore. Right, okay. Alright. Just another close look at this. Okay. Alright. I can see that lump there. Okay. I don't think it's anything to worry about. I think it's going to be a cyst, to be honest. They're very common around the ears. Yeah. But what I'll do, I'll inspect inside your ears and I will do a little biopsy on that today. Okay. Is that alright? It'll be a very small punch biopsy and I'll give you a little bit of anaesthesia first. Alright. But let me just have a look down your ears for now. Okay. I'm sure you've seen this before. The otoscope just goes gently inside the ear canal, okay, and lets me have a little look around, okay. I can see the eardrum all being well, unless there's anything blocking the canal, such as wax or any swellings, and I can look at the skin inside the ear canal as well. Okay, in a healthy ear, I should be able to see the structures behind the eardrum, okay, and no bubbles of fluid or no bulging or no crinkling of the eardrum. Okay, alright, well, we'll have a look at this one first. Okay, I'll just need to pull up and back on the ear as I insert this, okay, but I'll talk you through it. Alright, keep nice and still for me. Here we go. Okay, so just going to pull up and back on the ear and insert that now. Is that okay for you? Yeah, okay. And have a look around. I can visualise your tympanic membrane, your eardrum. There's very little wax in there, so that's good. The walls of the ear canal look absolutely fine. I can visualise the structures behind the eardrum, and there's no visible bulging or wrinkling of the membrane, so that's good. That's good. Okay. And just a little bit more there. Is that comfortable? Okay. Alright. Just moving it around very gently to get a better look. That's wonderful. That all looks really good, so I'm just going to withdraw the otoscope now, okay? There we go. Well done. That all seemed fine. I can't see any reason at the moment why that ear would be feeling a bit unusual, unless you've been playing with it thinking what's wrong with my ears, because this one feels a bit strange. But I can't see any signs of redness, infection or wax there, which is a good sign. But let's have a look at this. Okay. Alright, I'm just going to get around here, pull up and back on here. There we go, and insert the otoscope just there. There we go. Very gently. How does that feel for you? Good, good. Okay. Ear canal looks fine. No redness, no swelling. Not much in the way of earwax, just a normal healthy amount, which is good. Let's just look down there. Your eardrum looks absolutely fine. Structures are visible. No fluid, no bulging, nothing like that. That's all really, really healthy. Okay. Just move a little bit there. Okay. Perfect. I'm now just going to withdraw the otoscope gently. There we go. Wonderful. I can't see any problems inside your ears, which is really good. Okay, I just want to have a little look in your eyes, if I may. And I'll just check to see there's nothing looking red or sore around your eyes. Can you just look straight ahead at my nose? Thank you. Okay. Perfect. Okay. Alright. You've not had any problems with your eyes at all? No. Okay. That looks good. Okay. Just going to have a little feel around your neck, okay? At these glands. Alright. Just a little press down your neck there. Okay. That's good. Can't feel anything unusual, but I can just feel that lump by that ear. Okay, that's good. Right, so I think what I'm going to do is I'm going to give you a little bit of local anaesthesia, alright, in this ear where that lump is, and take a tiny biopsy. We can get that sent off to look at. Is that okay with you? I don't think it's anything serious at all, but we have to just make sure. Yeah. Okay, well, I'll be back shortly and we'll get that done. All right. Okay. So I'm just going to change my gloves to my surgical ones. And we'll do this little biopsy for you. Are you okay with local anaesthesia? Lidocaine? Good, okay. We do have alternatives if not. Make sure these are on nice and tight. Okay. So, just going to clean the area again. There we go. Okay, so I'm just going to use a tiny amount, okay, of anaesthesia. Alright, so I'll give your ear a little wiggle, alright, while I'm doing it. And it'll just feel a little sharp scratch as it goes in, okay? Keep nice and still for me, won't you? Alright, here we go. Okay, just going to give your ear a little wiggle. Alright, and in we go there. Just a tiny little amount of anaesthetic. There we go. Well done. It doesn't take long to take effect. Okay. So what I'll do, I'll just have a little check around the area with these, and you can tell me if you can feel anything. Alright, okay, can you feel that? A little bit? Okay, I'll just pop a little bit more in. Alright, just a little bit more there. Okay, perfect. Get that a little wipe off. Just check that now. Looking good. Right, let's try again. How's that? Can't feel that now? That's perfect. That means that you're all ready for me to do the little punch biopsy. Now this is a tiny punch biopsy tool. Okay. It's 2 mil, which is nothing. So it's only going to make a little punch. Let's just undo the packaging there. Okay. There we go. Okay. I'll need that. Alright. Here we go. If you feel anything, just tell me. Okay, can you feel this? No? Okay, and here we go then. I'm just going to take the biopsy now. Okay. There. Well done. to get the sample pot, and this will go off to the lab. So let's just get a bit of tissue there. Just going to pop it in, and I just need to add a couple of drops of preservative, just so it keeps it perfect for histology to check. There we go. Let's just pop a little bit in here. Okay, and wonderful. All done there, so that's all good to go. And I'll pop that back on there. And what I need to do now, I'm just going to put you a tiny, tiny little suture in this, okay? I'm just going to examine it first. I think this is a cyst. I really do think that's a little cyst because there's a little bit of content coming out there. There we go. But I'd rather get that checked. Okay. So, I'm just going to prepare a suture and we'll get that done for you. The anaesthetic should wear off in about half an hour. This won't last too long. It's just a tiny, tiny amount. Okay. Right. So, I'm just going to do a very small suture. Okay. Alrighty, here we go. In there. Wrap it round. Tie that. You'll just feel a little bit of pressure as I tie that. Okay, and snip. There we go. All done. Okay. Just check that now. That's all good. I will just pop a tiny dressing over it just to protect it a little bit. Okay, try not to get it wet for a day or two. Yeah, and we'll have you back in about 7 days' time. I can take that stitch out and we'll have the biopsy results quickly. We have our own lab to do the biopsy testing here. Yeah? Okay. So I'm just going to get this little dressing. And pop that over. Okay. There we go. It's a tiny, tiny dressing. Right. Just check all that now. Does that feel okay for you? Good. Okay. Well, I'll update your notes shortly. And if you pop to reception and ask for an appointment for about 7 days' time, at least 7 days, but everything should be good by then, and we'll get those stitches taken out for you. Okay. If you have any more problems, do call, but I'm not going to give you any treatment for your actual ears. I can't see any problem with them. They've certainly not got any infection or anything like that. Okay, so I'm not going to give you anything for that. I did wonder whether you'd got a little bit of otitis externa, like summer's ear, but there's no sign of that, so there's nothing I can give you for the ears. However, if you do develop any more symptoms, do come in or give me a call. Okay, right, finally got those gloves off. if all's well, I'll see you in about 7 days' time, okay? And we'll get, I've got a very slippy mask today, we'll get these stitches, or stitch out of your ear there. Okay. Take care, enjoy the rest of your day, and I'll see you soon.